Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am your co host, Jocelyn Turner. Such a lovely day in Northeast Florida. Well, I thought it was spring, but it looks like we have a dose of fall. It looked like a fall day and not a spring day here in Northeast Florida, but nonetheless a great day here in Jacksonville. And I'm so happy tonight that we have a very special guest. But before I continue, I have to bring in my co-host, Dr. Rogers Kane. How are you doing this evening, Dr. Kane?
I am absolutely wonderful, excited to be here, excited to hear from Donna with the hard work that she's doing in our community and for us to be able to move forward.
You're right, Dr. Kane. This is really exciting to have Ms. Donna Deegan, mayoral candidate here in Jacksonville. And I love how she has community advocate because that's what I've seen after she left her broadcast career on what's now First Coast News. When she started, it may have just been simply Channel 12, not dating you or myself, but I think that's what it may have been at the time. But welcome, Donna. How are you doing this evening?
I'm doing great. Although, I gotta complain along with you about the weather. My husband told me this morning, he said, I think you got a nice window to go out and take a run this morning.
Right.
And so I walked out the door and I got 3 blocks down the street and the heavens let loose.
How long a window? That was the issue.
Yes, and that's what he'll argue. I didn't say how long the window. He's really a natural born politician.
Typical man response.
But no, it's great. It's listen. In a few weeks, we will be wishing that we had the cooler temperatures that we have right now. Probably.
Isn't that the truth? Well, we're so happy that you made time to join us tonight for our viewers to hear what your ideas are about health and healthcare if you are elected as the next mayor of Jacksonville, Florida. I know that a little over a year ago, you and Dr. Kane and some other people more important than me, some other people got together. And Dr. Kane, how about you talk about what you and Donna and others mentioned or talked about in a news, I think it was some kind of press conference or something downtown?
It was, but I do want to acknowledge all the others that were there. Jeff Goldhagen, Chanel Jossie, and I'm blanking. But the co-sponsors of this whole Zoom, the Northeast Florida Healthcare Consortium that was created initially in response to the ongoing issues with the COVID virus, as well as the Partnership for Child Health. All of us took the lead in terms of trying to make sure that Northeast Florida was well represented with regards to what is the best avenue to take care of our fellow Northeast Floridians at that time. Donna approached us, which I give her kudos for because nobody else did. Donna approached us and asked us our opinion because she was looking at running for mayor, but she wanted healthcare policy because she thought it was very important. I love her elaborate on that point, but she thought that was one of the most important things we needed in Northeast Florida. And given that, she decided, and I'm not putting words in her mouth, but she decided that she wanted to go to the people who are out on the front line and who are actually taking care of patients and can help give her some insight and some guidance, advice as to her healthcare policy. And so over a year and some change ago, we all met, not in a back room or anything like that, but We all met and got together and started discussing policies and issues that was concerning Northeast Florida. And Donna, brilliantly her, along with, I can't go without mentioning Carolyn.
Carolyn McClanahan, yes.
McClanahan, they got together, and all of us got together and came up with some ideas. And Donna, and Carolyn actually are the final authors of this plan. But of course, she's had the insight to go and talk to people who are on the front line. So I'm gonna let Donna take it from there and let her, present her healthcare plan and policies or ideas to our audience. And then we're at when she's finished, if there's some questions and stuff that people have, they can remember to go to the chat and so on and so on. So, Donna?
Well, let me just say thank you. First of all, I'm so glad that we're here to the point where we're actually talking about this in a forum like this, because I'm really so excited about that plan. I spent, well, you all know my story. I had breast cancer 3 times. And in the process, I was on the air during all those years. And yes, Jocelyn, I was there for when it was Channel 12, and I was there for when it was First Coast News. So for 25 years, I heard the stories of people who were going through the same things that I was going through, only they were having to choose between food and medicine while they were in that process. And it literally, honestly, it broke my heart. And I just thought, how in the world can this be possible in Jacksonville, Florida? And the more I looked into it, the more I realized just how big the problems were. And so I started the Donna Foundation basically because I was very frustrated about the disparities in healthcare that I saw, and then started spending time with some of the partners of the Donna Foundation, one of them being a Patient Advocate Foundation, just talking about policy and what policies could we push, that we could look at for changing healthcare. And you know how hard that is to do on the national level. It's a full-time job for people. And so when I decided to run for mayor, I knew that that health was going to be a big part of my platform. I have 3 pillars, and one of those pillars is healthcare. And I can't tell you how many people said to me, why healthcare? Nobody cares about healthcare. And I said, the only people that say nobody cares about healthcare are the people that don't have to worry about healthcare. But the truth is, and this is when I came to you guys, we have some of the finest medical institutions and doctors in the whole country here in Jacksonville. And yet we have some of the worst health outcomes in the state, and frankly, some of the worst in the nation when it comes to our maternal mortality and our infant mortality and our measures of primary health, like heart disease and obesity and all sorts of measures of health. Why does a place that has so many fine medical institutions and physicians have so many people who fall into those categories? And what can we do to move those numbers? Now, obviously, what I would love to see us do on the statewide level, it still really bothers me that we're one of only 9 states, I think, are left that have not expanded Medicaid. And of course, now we're in a big, battle over all that since we had COVID. But it's frustrating to me, and that's something that I will continue to advocate for, because it's obviously a great cost burden to our hospitals and obviously causes a lot of people to fall through the cracks. But as a mayor, what could I do? And I thought, the one group of people that nobody has gone to really is the people on the front lines, the doctors, the nurses, the other folks that on a daily basis deal with patients. And I think we started off, Dr. Kane, you can correct me, I think we started off with probably 40 people in this group, where we just were getting input for months before we actually came up with the plan. And we had a framework of what we really wanted. We thought, okay, we'd love to go big. What can we do that will actually be able to make an impact that we'll be allowed to put into place here that possibly we can build on? And so what we ended up coming up with, before I get to that, let me back up a second and say one of the big issues locally, and tell me if I'm going on too long, but I think this is important background stuff. One of the issues locally or in the state of Florida is, I think 20 some years ago, we decided to centralize all of our public health to the state in Tallahassee, which we're seeing so much of now. Everything's getting taken away from local rule and taken over to Tallahassee, which is a huge mistake, but I could go on about that all night. But that's cost us a whole lot of money, millions of dollars in public health dollars. And we also really don't have a whole lot of teeth locally for our public health administrators. So what we decided to do is let's create a position, we started to call it a medical czar, and now I can't remember what we actually called it, a chief health officer. That's what it was. We thought that sounded better than czar. That is actually a doctor that could oversee the services that we have in our city, the nonprofit organizations that are offering healthcare in various ways, to coordinate those, to create some efficiency in the way that the city can help to bring down some dollars to help them be better funded, and then to create an education arm where we can actually have connections between. There's so much of our city that just needs better education. If we educate people about what's available, we get more money to those wonderful organizations that are doing the work, and then we connect people to those organizations to get healthier. We might be able to move some of those numbers. And I think we really can. I think a big part of it is that we just don't have that focus anymore. The right hand doesn't always know what the left hand is doing. So if we had a coordinator that is, and I think it's important for it to be a doctor. I think it's very important for it to be a public health physician. I think that's just going to be real important to coordinate those services, and then to help make sure that we have some accountability built in. So we make sure that whatever we do, we can actually have some metrics for, are these programs working? Are the dollars that we're helping to bring to this organization actually moving the numbers? And then, of course, just continue to try to advocate for more state and federal dollars. We leave a lot of state and federal dollars on the table for just about everything that we do in the city. In fact, I've had people that are currently in city government that suggest to me that's in the hundreds of millions of dollars that we leave on the table simply for political reasons, because we really don't like who's the president, or we don't like, I don't care about any of that. I don't care who the president is. I want my tax dollars back here in Jacksonville working for me and for you. So I think that's a way we start moving the dial. It starts with people who know what they're doing, coordinating the services that are there, and making sure there's not a lot of duplication, but there's a lot of coordination, and then making sure that we can get those folks more money and educate folks about what's available. So that's the plan. It's not expensive. But it is something we can do without having to ask anybody else. And that's going to be important, I think, as we step into city government. So I'm very excited about the possibilities of what we can do together. And I believe this is an issue not only that of doing what is right for people, but I think you cannot have an economically thriving city unless you have a healthy city. And of course, there's that encompasses mental health and a number of other things as well. And I also think we have to connect into, as I know Dr. Kane talks a lot about, the social determinants of health. And those are, I'm looking forward to partnering with the city and the Blue Zones Initiative, which is looking at ways that, right now, doing an assessment, looking at ways that we can better create communities that are healthier. Blue Zones is for those of you who aren't familiar with it, and I'm sure most of you are those areas in the country where people seem to have the best health and well-being. What is it that makes those communities healthier? And a lot of it has to do with creating communities that are walkable and bikeable, and where there is not food scarcity and those sorts of things. So I'm excited about all that. I think we have an opportunity with the right priorities to have a much healthier city.
So you mentioned creating that position, that czar, or that chief health officer. I retired from the health department and know that, that's an area that they had a director, right? They've been an interim director role for several years now. But how do you envision your chief health officer working with the public health department? And really, my question was going to be, how do politics affect public health?
Well, politics affect public health in just about every realm these days. I mean, that's the frustrating thing to me, is, when we created, the public health initiatives 50 years ago. I mean, it sounds like a wonderful thing, and then politics gets involved. You see how we handled issues around COVID, how politics gets involved in reproductive health. I mean, those are things that are extraordinarily frustrating when politics become involved. But it's another reason why I wanted so much to have that position be headed by a physician, because I think physicians are going to have the best interest of the patients, of the people, at the top of mind, at least primarily. And I don't want politics to be involved in that. I really don't. And I think that when politics become involved, policy can get pretty messed up, and we've seen that. So my interest is going to be in doing what's best for folks in Jacksonville to make them healthier.
And going on what Jocelyn said, the politics actually cost more money than it does anything to save money. Physicians can be advocates for patients, advocates for the system. They can be the go-between for those in City Hall who want to do well, but may not know exactly what to do with, as opposed to those people that have boots on the ground and actually confronting public health issues on a daily basis.
Right.
And there has a whole lot of things that they have to be accountable to, especially with budgets and stuff of that nature. But if you don't know, if you don't understand the system, and obviously we don't expect, like even the president, he has a whole cabinet that gives advice on stuff, which is what the mayor should have, doing the same thing with their city. And as long as we can have an input, and when I'm saying, I'm talking all healthcare professionals, because the nurses really do a stand-up job. They work hard, but by the same token, they need some assistance with their daily activities as it relates to taking care of patients.
Sure.
Instead of necessarily trying to spend money on the back end, my whole thing has always been, let's spend money on the front end to get, this preventive care. And we've been advocates of that on our program since day one.
Well, we talk about making sure that people have access to these services, but at the end of the day, what we all know is that by and large, primary care is not expensive. It's not expensive. And you talk to people across the political spectrum, and if they're not worried about how they're going to look as politicians, they'll agree with you. If we were able to make sure that everybody had primary care available, that's a very cheap thing. Where you run into the big money is when people get cancer 3 times, right? That's where you run into the problems where you need insurance. But if we could connect people to the services that would improve their bottom line health, their primary health, that could be transformational in the health of our community and our economy. And I think it seems like such a no-brainer to me. And whatever we can do locally for prevention, it's going to save us so much more money on the back end for when people, instead of waiting for people to get sick. And that's true of everything. That's true of everything in this city. That's been my argument as I've been running for mayor and visiting all these different neighborhoods and talking through the healthcare plan and all my other plans is, look, if you're constantly just reacting to things and you're not looking out and trying to make sure you're preventing instead of reacting, you're going to spend 20 times more money. And so, I wasn't there a ruling recently on the Affordable Care Act where they no longer have to no longer cover preventive procedures? Is that right? It seems like there was some new, I shouldn't even talk out of school on things that I'm not well educated on yet. But I thought I read that the other day. And I think that's such a mistake.
Yes.
Because
you need your czar. That's why you need your health czar, right? Or your chief health officer.
If Carolyn is in there someplace, she knows this. I guarantee it. But
I do want to ask you a question though, because you've mentioned a few times about your cancer diagnosis, and fortunately, you had the resources. Every day someone is diagnosed with some type of chronic health condition, and their primary care doctor, like Dr. Kane, may tell them, go out and take a walk occasionally, and because if you go out and walk regularly, not occasionally, that'll help manage your blood pressure or your blood sugar as far as your diabetes go. But you also need to make sure that you eat healthier. Well, those people may be very willing and interested to do that. But one thing that we know for certain is some neighborhoods in Jacksonville, they don't even have sidewalks. They may not feel safe getting out walking. nor do they have a grocery store that is, first, they don't have a walkable community. And then there is no grocery store in their community to give them choices of purchasing those healthier food option. How can your administration address these issues?
By making them a priority. If something is important to you, you make it a priority. And that's why infrastructure is the number one pillar in my campaign. And I think what we've done since the time of consolidation is basically we have kicked the can down the road on needed infrastructure in so many of our older neighborhoods. We made big promises to the old South Side and to the North Side when we consolidated this city, and we largely kept them to the South Side. We largely did not keep them to the North Side. And so what did you see on the South Side? You saw growth and you saw prosperity. On the North Side, you saw growth, but you saw a lot of deterioration. So I think we need to approach that from the place and in the cadence of how we've neglected. So I think the infrastructure in the urban core, the infrastructure on the North Side, on the Northwest side are critically important that we start to work through. And I mean work through not by throwing a one-time stipend at it and saying that we're doing something, but by creating a long-term plan. And when I say long-term, I don't mean over decades like you hear a lot of times. I mean, let's go bring down some dollars. There's a lot of infrastructure money right now. Let's intentionally get these lights and these sidewalks, this drainage, the septic tanks, all those things that will allow for a community to both feel safer and be safer for our health. Let's get those things done. And that's why, to me, all my pillars connect. And I think infrastructure is absolutely connected to safety, and it's absolutely connected to health, because people are going to feel a lot safer to get out in their community to walk and to ride bikes and to do those other things. And then we have to take a look at the food desert issues. We have to look at the heat issues. We have to look at our neighborhoods that don't have the tree canopies, and where they're 15 degrees hotter. That's going to cause a lot of health problems. These are all things that we have to be very, very intentional about in the short term, and then a plan for the long term. And we've got this, we've got a plan in the works to make sure that we absolutely can do that and get enough of it done to where people can't easily undo it once we're gone.
Access to healthcare is not just access to being able to get to a hospital or access to get to a doctor when you're sick. Access to healthcare include access to reasonable, good and healthy foods.
That's right.
Okay? Exercise trails or facilities where patients can get out and feel safe in their community to go out and exercise.
That's right.
Strong. And we've been advocates of that for the longest. We just never had anybody that wanted to listen to us. Okay.
Well, now you do. Now you do. And I think, listen, these are the things that if we don't take a very intentional approach, and I've said, and this is the conversation that I've had with those guys that don't like me quite as much as they like my opponent, and that's the big developers. And I said, look, if we don't intentionally start to really take care of some of these issues around climate, which affect some of the other issues you're talking about, your stuff's going to be underwater anyway, so it's not going to make any difference. We're going to have to very, very intentionally start to address these issues, and that's going to have a big impact on health. As far as the food deserts go, I can't tell you in these community. This is why I love these community meetings so much. We've been in so many town halls and community meetings where people have come up with so many innovative ideas about creating solutions for food deserts. There's a lot of little stores around that don't carry any sort of food at all. And people are talking about, what if you could get a grant for this store to carry this, and this store to carry this, and this store to carry this, where people had the opportunity just within the walkable areas of their neighborhood to get what they need. I mean, that's just one. There are so many, but people are excited about presenting these ideas and about coming up with creative ways to make sure that people have access to these things. I think that especially within our underserved communities, people have been absolutely starved to have somebody who even cares enough to listen. And I think that is the start of really rebuilding the trust with our communities, is actually being there, having those conversations, bringing in other people's ideas, just like we all did, a couple of years ago. I just think collaboration creates the the absolute best solutions. And it also creates a feeling of belonging for people in their city government. And I think that if we can bring people back inside of those processes of making those decisions and creating those solutions, we might not have 25% voter turnout in our elections. We might actually have people who are ready to jump in and pull, because they believe that we are, continuing to lift each other as we climb as a city.
I've been talking to younger people about exactly what you just said, Donna. Getting excited, getting them energized and wanting to vote. Dr. Kane and I have been talking about that, like why people are not excited, or even Tyrone, our behind the scenes guy, which he'll pop in every now and then and get on the scene. But how do you get younger people excited about voting? But I want to talk to you about how do we attract or how do we get younger physicians? I mean, do you envision or any tax credits or something to encourage younger doctors to work in underserved areas of the city? I remember, I met Dr. Kane about a little over 30 years ago. He was that younger doctor that worked in the neighbor underserved communities. So how do you envision getting the younger Dr. Kane and other younger doctors to work in underserved communities in Jacksonville?
Well, I think we look at a lot of doctors are employed by hospitals. I think we look at programs to see if they could get to get the hospitals involved in creating those sort of scenarios, to get programs where younger doctors can have the opportunity to serve in those communities and get credit for it. I think those are wonderful things to look at. I think I love the idea in all sorts of ways. Doctors, engineers, attorneys, let's get them all let's give them all incentives to live and be in those communities where they're great role models and provide help for young people who want to have folks to look up to and have the ability to see what they could become. So I think for a lot of reasons, health chief among them, that would be a wonderful idea that we could look at.
Well, Donna, you said to me once before, invest in them so they can invest in our community.
That's it. I have had young people at the time. I will tell you, there will be young people in my administration. We will have people that have some experience. We're also going to bring in some of these young innovators. We've got some amazing up and coming young people who are involved in exactly the spaces that we're talking about right now. And they're providing all sorts of innovative ideas of how we can get creative with food insecurity and things like that. And so I think it's really important to give them hope and to give them some agency as we continue forward to try to come up with these solutions for our city. So I'm excited about that.
Go ahead. I'm sorry.
No, I was just going to say, as I talk to them, and I've tried, again, we've got to get young people more engaged, but I think they're engaged when they feel like they're a part. And right now they don't have much reason. I was teasing the former mayor of Tampa the other day, Bob Buckhorn. We were talking about, how Tampa has just passed us like we're standing still on so many fronts. Yeah. And I said, yeah, I lost my daughter to Tampa, several years ago. She said, Mom, Jacksonville never changes. I'm heading to Tampa. So I have a bet with him that once I get into office, I'm going to get her back. So I don't know what we're going to bet on that, but I said, we're going to pass you one of these days, because we're going to be, I could see Jacksonville becoming, Tampa, and way more than Tampa, because we've got a lot more than Tampa has to offer when it comes to just our natural amenities in this city. But I'd love to see us become a hub for medical tourism, but it's hard to argue about that when you got the worst health outcomes in the state. So we got to deal with that before we can really get heavily into those discussions. But I mean, there's so many reasons for which this community should thrive and be attractive to our young people to want to stay.
I was listening to NPR the other day, and they were discussing how it's so that I think a lot of other politicians are being very dismissive of climate change.
Yeah.
And our youth being concerned with climate change. Because one of the things we've always advocated on this show is that, we want to make sure that you can breathe in the future.
Yeah.
And you don't drown in carbon monoxide, dioxide, or whatever, and water. So, what do you have? What are your thoughts on what we may be able to do in this city? I know it's a smaller scale, but
Yeah,
still,
but I mean, just things like converting to electric vehicles. I mean, I think that's one of those things. I mean, our fleet of vehicles is getting to the place where a lot of it has to be replaced. Let's go to electric. Let's make sure that we're not putting so much junk into the air. That's one of those things. But also, we need to look at our buildings. We need to look at retrofitting our buildings to make sure they're more climate friendly. Look, heat is going to be our biggest enemy, especially when it comes to health. That's a big deal. We should look at making trees a part of infrastructure definition. And if we could make trees a part of infrastructure, then we might be able to get more money also to create better tree canopies for our neighborhoods. And that also helps in terms of sucking up some of the water that we need to make sure that we're doing. So there's so many things. Our building codes. We've got to make sure that we're building in a responsible way, set far back enough to where we have a barrier. There are so many things that we can do. Some of them that aren't expensive, some of them that are probably going to cost some money. But we've got this chief resiliency officer now, and we've given her some money to do studies. Now we know what the greatest threats are, and we need to now proceed as a city that's going to lead instead of follow on these issues. I'd like to see JEA move more forcefully toward solar energy. I mean, there's just no reason for us to be as far behind the curve as we are on some of these issues. And I would love to see Jacksonville, Florida become a leader when it comes to resiliency. And that really all, if we use the term resiliency because people didn't like to used to talk about climate change. Now it's not nearly as verboten as it used to be. But the truth is that's what's happening. It's causing our seas to rise, and it's going to cause all sorts of problems for us if we don't deal with it. And people are starting to see those things now. We've got to deal with all the flooding, and that means we've got to deal with our drainage. Look, we are a city that is built basically on water, on a swamp.
yeah.
And so a lot of our infrastructure is falling apart. And as we rebuild it, we need to rebuild it in a very resilient way that basically underscores the fact that the tides are rising, and we're going to have to deal with that.
But I've seen, I've just gotten so mad when you talk about trees. I've seen so many trees being cut down. Airport Road. I just could not understand why all of those beautiful trees all of a sudden started coming down. I'm like, oh my goodness, do people not understand the importance of trees?
Listen, I got to tell you, that is one of the things that is just one of the things that makes me crazy. I had a woman that called me yesterday and said that there was a lot that was across the street from her where they gave the person building permission to cut down 15 live oaks. I mean, hundreds of year-old trees. And guess what the fines were they had to pay in order to do that? $18,000 total to take down 15 live oak trees. That's criminal. And it's horrible for so many reasons when it comes to resiliency. We just don't need to be doing that. And we need to find some way to encourage, at the very least, our folks who are developing properties to not clear cut. I know it's cheaper, but boy, is it bad for the environment and bad for our health.
I think that I'm a health educator by nature, by trade, I should say. And I think a lot of it is education. People don't understand the consequences of their action. The reasons for doing it may be a good reason for them. Maybe they might be putting 15 tiny houses on the land, whatever the case may be. But at least know here, before you do that, let me tell you why it's important to have trees, right? If you want to build a tiny house, build it next to a tree, right? Don't remove a tree to build a tiny house, move them in between. So I think a lot of it has to do with the lack of education, the lack of knowledge people have. And we've got to do more with having conversations. And speaking of which, when we talk about those things that are uncomfortable for us, let's talk about the homeless situation. Mm-hmm. There are a lot of people who are homeless, who have mental health issues here in Jacksonville. How do you envision addressing homelessness as well as mental health issues here in Jacksonville if elected as our next mayor?
Well, homelessness is a huge problem, obviously, and exacerbated by what happened with COVID. But it starts with having more affordable housing. I've got to say that, you know, for years the state has raided the Sadowski Fund for affordable housing. They put a little bit back, but we don't invest in affordable housing here in any sort of meaningful way. We have some wonderful organizations that do wonderful work in that regard, nonprofits. But for instance, there are a number of cities our size that are investing, gosh, tens of millions of dollars more a year than we do in affordable housing. So it's something we're going to have to look at because it's a huge problem. I think we're minus like 40,000 affordable housing units right now. That's where we are. So we need to look at taking some of the you know, the vast empty lots that we have all over the city and see what we can do with those. We need to have more infill. We need to start building. This is part of the infrastructure. We need to start building more intentionally in some of our areas that already have built-in infrastructure, investing in our older communities and changing our zoning so we can have a little more density in those places. That will all help with affordable housing. But that's only, I mean, you know, we could talk about affordable housing all day. I mean, you have all these out-of-state investors that are coming in and buying up the property and robbing people of their generational wealth and jacking up the rent prices. So all those things are part of the homelessness issue, especially the new homeless. We have a lot of that, but mental health is a big issue. And honestly, you know, one of the policies that I've always wondered about, and I would like, and I probably need to have some more discussions about this because I want to understand it, is the policy at our homeless shelters is that at 5 a.m. or 6 a.m. in the morning, people have to leave. And then I guess the idea is they're supposed to go out and find a job and then they can come back. If you have a mental illness or you have an addiction, that's not going to happen. So where are you going to be? You're going to be out on the street. And then people are going to be frustrated about that. So I think we need to, again, instead of just trying to hide people, which is basically what we've tried to do in the past, we need to make sure that we are providing those services and funds for services that address mental health issues, that address addiction. And that's going to take longer, but over the long term, it's going to create a better outcome for us. It's not going to be like just taking people and moving them from one place to the next so that whoever's complaining in one community won't be the ones always complaining. That's basically, but we have some wonderful services for homeless people. We just have to make sure that we're dealing with some of those other issues around homelessness.
Quickly, Donna, what is the Sadowski Fund again?
It's just the affordable housing fund at the state level. We've had billions of dollars, or at least $1.5 billion swept out of that over the past several years. So they're supposed to set aside money every year for this fund. And then that money is supposed to go into our communities for affordable housing. And every year, up until this year, when they got so much pressure, they wanted to look like they're doing something. You know, they sweep the money out for something else. So it's like so many things in this city. You know, we're going to earmark the funds for this, but if somebody else wants those funds, we'll just move them over here. You know, we've seen that happen with the Northwest Fund over and over again, right? All it takes is somebody to apply to get those monies outside, and then they're just moved over. So it's a shell game, basically, is what it is.
I'll just say Lot J and leave that alone.
Yeah, I mean, honestly, that is, we are in such an appalling lack of accountability for everything that we do in this city right now. If there's one thing that I hope that we can bring into City Hall, it is accountability for how our programs or how our money is spent, how those things that we are spending money on are working. And I don't think that's too much to ask for people if you're spending their tax dollars.
So I have a question. A lot of older people move to Florida. So we have to talk about someone said the geriatric population, but what policies and programs would you champion to address the needs of our geriatric population here in Jacksonville?
Yeah, that's really a big issue. I got to say, in the last part of the campaign, when we were going through the primary, we visited, we had a forum at one of the senior centers. And I got to say, we got an earful about things, the amenities that they used to have that they don't have anymore. One of those things being mobility. They just don't have the ability to get from point A to point B like they used to have. So We have a senior services division, but we don't offer nearly the mobility services that we used to. That's a big deal for seniors. I think that's part of it. So, but I think we just have to make sure that with our chief health officer, that we're connecting people to more of those services that are needed in those senior communities. Obviously, that community is going to continue to grow, and what we've seen over the past several years is a shrinking of those services, not an expansion of those services. So I think that's going to be something that our chief health officer can look at. And again, I don't know why we couldn't bring down more dollars for that as well.
Thank you. Sounds like the chief health officer is going to be very busy, and I like how you're weaving them, if you will, into all areas.
It's an important position, and that's why I said that's why I'm just so I'm excited about all the ways in which we can connect the dots, because I think we talk about. I just think it's going to be so very important to make sure we are coordinating services, all health services in this city. We have so many great nonprofits doing wonderful work, and nonprofit hospitals doing wonderful work. But let's make sure we intentionally focus those things on ways that they can best serve the community. And I don't know that we're doing that right now.
Yeah, one of the things I've learned about recently, it's appalling to me is, and I'm not going to say the area of town, but I've learned that there's a certain area in Jacksonville that has the most child removals. Just imagine that, the most child removals.
Yeah, it's terrible.
And knowing that somebody's tracking that data, where are the gaps? Like, what's happening so much in that community that nobody can wrap their arms around those families and say, what is it that's happening with you? Did you know that you, as well as most of your neighbors, are having most of your children removed from your homes? What can we do to help you?
Listen, I think I talk about this with small business all the time. There are so many tools available to our small business people that the city does not even take the opportunity to share, to educate people. There are a lot of small businesses that go out of business because they don't learn about how they can get facade grants, or they don't learn how they can be connected to incubator programs, or they don't learn. And it all depends on how well connected they are to the people who are in power. And I think the same is true there. I think if we simply I think education is such a big key to just about everything. Mm-hmm. We have got to make sure that if we care enough about people, that we connect them to things that are already there and available to them. Somebody had a question that I saw, and I'm sorry.
Yeah, the question was about all the millions of dollars that are given to UF Health for public health.
Yeah.
How about
could we leverage that for our
right, to support more dollars for public health, including a new physician chief health officer? As I mentioned earlier, the local health department hasn't had a director, a physician in charge of the health department in 5 years.
Yeah.
Right. And some say it's largely due to the salary that they're paying a physician. So what will you do to leverage that to support more dollars for public health?
Yeah, I'm not, look, I think UF Health, I'm not exactly sure I understand what's being asked in the question. I think UF Health is just drinking from a fire hose with everything that UF Health has on its plate. I'm not saying that our hospitals can't do more in terms of or be directed in a better place in some areas like this. But I don't know. I'm not exactly sure that I understand what the question is. How can we leverage that to support more dollars? If we're talking about drawing down more dollars, then yes, I think probably we can. If we're talking about using the dollars that they have right now to create that position, I don't think that's something we could do.
I'm wondering if what may be the question is referencing is UF Health. They are the city hospital.
Sure, right.
And what we're not seeing is money is being put into prevention.
Right.
That hospital from being so busy.
It's a triage area basically. So many times. I mean, I've spent so much time in the emergency room there, and I just don't even know how the physicians there survive. That's just it's a really, they're amazing, but it's a really difficult situation.
Yeah, we want to get, again, we go back to getting it on the front end.
Yeah.
And trying to treat it on the back end, and regretfully, they're faced with treating the tertiary medicine, and that they're treating after the injuries and the issues have occurred. Mm-hmm. And we need to put more money up on the front end to keep those guys from having, people from having to use the emergency room for their primary care.
Right. Well, again, one of the things that we can do, I think, too, as far as education is concerned, is to help people understand how to sign up for the Affordable Care Act. I think a lot of people just don't understand the subsidies that are available there for them and believe that they can't do it. And if that is one of the services that we could provide to help walk people through that process and make sure they know they can get coverage. It is amazing how many people I talk to that don't know that is available to them. And I think that's one of the places in which we could use education to maybe take some of that burden, off the table, but it's hard.
It's hard, at least.
Yeah.
So most mayors like to leave their imprint or impact. What type of imprint would you like to make in the healthcare sector of the city of Jacksonville as mayor?
Well, I'd like to look up after 8 years and see that those metrics on primary health and on so much of the health of our community are so much better. I am both hurt and embarrassed by the numbers that we have right now, and it is purely due to a neglect of our city to actually try to meaningfully do something about it. So I'd love to be known as the mayor who made Jacksonville healthier. I've got all kinds of ideas, but I love to move, and I would love to. I'd love to encourage other people to move. But I think if they see their mayor involved in these initiatives of health, I just think that is going to be something that could help move the dial. So if I could leave a much healthier city, that would, if I accomplished nothing else besides that, I would be a very happy former mayor.
So I like how you said you want to see the metrics move. Sounds like a needs assessment is going to need to be done at the beginning of your administration in order to know whether or not in 4 years or 8 years, as you said, if the needle moved and things did change or things did improve.
Yeah, I like to. I'm not the data. I'm not the person who will do the data, but I like to read the data. And I think data is incredibly to justify. And frankly, if you're going to bring down a lot more of these federal and state dollars, you're going to have data, and you're going to have a strategic plan beyond that. So these are all things we've just failed to do. We literally live hand to mouth in this city in terms of how we plan. We don't. We react. And so it's incredibly important to me to gather the data that we're going to need to justify the things that we're doing and to show that we're actually moving the dial. Yeah.
Well, it took several decades to make this mess. It's going to give us at least, maybe we need a decade or close to it, 8 years of Donna Deegan's management to help us get out of this mess.
Well, I'm looking forward to having all of you as partners in trying to move this dial. I'm sure there are many ideas out there of ways that we can move these numbers, and I'm open to all of them. I can't tell you how much I enjoyed all the meetings with the doctors and the nurses and the other healthcare professionals. The energy that we had in those meetings, the excitement when we got over the frustration that nobody's asked before, right? There were a lot of discussions about that too. I think if we are going to be a people-focused organization, and I want to be, if my administration is going to put people first, then you have to bring the people into the process. And I think that the best people on this front are going to be you all that work through these things every day.
And
you mentioned that Jacksonville is fortunate to have several health insurance companies and hospitals and professional organizations like the Northeast Florida Medical Society and the organization that I'm a part of, the Population Health Consortium of Northeast Florida, and other groups. but we are also a neighboring community, a neighboring city with St. Johns County. That's one of the healthiest county in the state of Florida. What in the world? I mean, literally, that is just so amazing to me. You would think that if you live in Jacksonville and you have any sense of curiosity, you'd want to visit St. Johns County and say, what are they doing? Sure, we know they're smaller, but still smaller does not mean that you're able to wrap your arms around it any better.
Well, they're very affluent. It's a very what people have done for the longest time, and Jacksonville has promoted it because of the way that we have allowed sprawl to happen in this city, is basically we have decided that we're going to go and build all the way out to St. John's. Look, I got no problem with people who want to live way out. That's fine, except that we've had to create the infrastructure out there. And what we've done is we've done it at the absolute neglect of our older neighborhoods. And if you have a neighborhood that's older than 15 years in this city, your infrastructure is probably fallen apart. So look, I just think we've incentivized people to move across the county line. I think that's exactly what we've done. A lot of people have gone for schools, but it's a different world. And a lot of it has to do with the fact that it's a very affluent community and it's small, as you said, a smaller community. But we've had a lot of neglect here, a lot of neglect of our older communities. And that's where the repair absolutely has to start.
Yeah, last week we had moms demand action. Nobody, and we all agreed nobody's trying to take guns from people, none of that. But we are also fed up with seeing shootings in schools and other places. Do you envision working with and school should be a place where, I remember when I was in school, I loved going to school. I never thought about school shootings or anything like that. I thought about meeting cute boys and okay, learning. Yeah, learning, right?
Right.
But you know what I mean? It should be a safe haven for children. Do you envision working with our superintendent to make sure that our schools are safe for our children?
Yeah, there's a program, and I knew the name was going to escape me if we got into this topic, that I've already endorsed that the school system does. I want to bring the city into that program. It's called Safe something, and I can't remember what it is now, but I signed off on it probably a year ago, and that is basically, and I know this is a small part of it, but the state once again has passed laws that have made it so that we're not allowed to pass local gun laws. Again, that's another local rule issue the state has taken away. First of all, doctors weren't allowed to talk to their patients about gun storage, and then we took away local ability to make any sort of restrictions as far as what we do with guns. So what can we do? Well, we can try to instruct and educate people about the best ways to store their guns. To store them safely so that kids can't access them and either intentionally or accidentally hurt somebody. That's a big deal. We've got a lot of unfortunate situations where a young kid will find a gun and hurt somebody or kill somebody with it, or take it and do something awful with it. That's something that at the very least we can educate people about. But this is something that I really wish that this body, and I have to believe that everybody on this call is probably aware of the fact that a lot of our ability locally to move the dial on these issues has been taken away from us. So that we can do. We can educate about gun storage. And I think that with one voice, we can simply say that we want our children to be able to live in a safe space where they don't have to worry about violence. And the answer is not to make our schools fortresses. The answer is to demand better from the people that represent us in Tallahassee and in Washington. And I know that feels like pushing a boulder up a hill, but it sure does feel like when we see things like what we saw in Tennessee the other day, where you actually had lawmakers who were expelled from the legislature for standing up with so many young people who were there demanding better action on guns. This is the issue that has engaged our younger population, and they are very, very forceful on this issue. And I think at some point we're going to see that the people in Tallahassee and in Washington have to move. But right now we're moving in the wrong direction. We just approved permitless carry in the state of Florida, and that's certainly not going to make us any safer. Even though 75% of the population is opposed to permitless carry, we did it anyway. So people need to pay attention to who they elect.
I joke with Jocelyn all the time, reminds me back in the day when I was a younger man, and you're talking to Wild Wild West. In terms of, for those that are familiar with the old,
yeah,
you guys catch my drift.
Does anybody remember when Corrine Brown was in the Florida legislature and she stood on her desk and said, "Florida is the wild, wild west"? Do you remember that?
I remember that.
Oh, I remember that. That's one of my strong. I used to cover the legislature back when I first got into news, and that would send me over there, and I thought, man, that's taking it to them right there, But, they're going to do what they're going to do, I guess, if you allow them. But it's one of the reasons we need to have a little more balance in our government, because you sure doesn't seem to work to have a super majority of folks who are just going to do what they want to do, regardless of what the people say they want. But
I think one of the things that you just said is one of the reasons to do that. But one of the bigger that really espouse one of the reasons that we need to get out and vote. I know people say all politics are local, but we do need to start at home, not just for a presidential election or national election, but it makes so much difference with who your leadership locally first. And then we can expand beyond local to state and then national. Listen. But what happens to me every day, around the corner, across the street, down the road, and so we really need to want to encourage people to get out and vote. If you agree or disagree with whatever has been discussed this evening, at least get out and vote on it.
Yeah, it's so important. Like I said, I think that a lot of people have the idea that local races don't matter, and there's really nothing that impacts your life more than local politics. And I think, especially given the fact that we have so much gerrymandering that has gone on at the state and national level, it's really the only place left where we have control by just going out and casting our ballots. So I hope people will do that. I would love to get back to a time where the people have a greater say in what happens, we only do that by getting out and using our voices, and that's just. I hope everybody will do that. I hope
every election, vote in every election.
Yes.
So a lot of what we talked about tonight, as we near the end of the show, is the importance of public policies, and people don't think about the public policies that exist to help make things safe, as far as Safe Drinking Water Act, the No Smoking for the Clean Indoor Air Act, and other policies that are in place to assure that the things that we take for granted are taken care of. We also talked a lot about education as the foundation of, the more people know, the more they can understand why those policies are put in place in order to help them and their families. At the end of the show, we always like to give our guests, Donna, an opportunity to share their final thoughts. So what are your final thoughts for those folks who've decided? And by the way, we didn't say at the onset, we also, we hope that the other candidate for mayor will join us on the podcast, because we like for people to get varying points of view so that they can make their own decision. Because as Dr. Kane said, we just want to make sure that people are educated so that they can make informed decisions. But at the end of every show, we'd like to give our guests an opportunity to really share their final thoughts. So what are your final thoughts if you are elected mayor of Jacksonville, as far as addressing health and healthcare here in our community?
Well, I'm just grateful for the opportunity. I say with every opportunity that I get that it's only by the grace of God that I am still here. After 3 times with breast cancer, I feel like I owe a whole lot to this community, and I want to spend every day trying to make life better for people in this city. And it's why I'm running. I want to see this city thrive, and I want everybody to have an opportunity for a good quality of life. And I think that starts with being healthy. So I'm looking forward to being the healthcare mayor, and I hope that I have that opportunity. Thank you for letting me speak tonight, and thank you for your questions.
Oh, you're very welcome. And if you'd like to come back before the election takes place, we can definitely squeeze you in on the calendar. Dr. Kane, what are your final thoughts for tonight's discussion?
Well, I really appreciate and thank you very much, Ms. Deegan, for coming onto the show. I think you've educated and informed people quite a bit about concerns, especially as a physician that takes care of people on a day-to-day basis. Is I couldn't retire. I'm overdue for retirement, but I couldn't because I really still love this community and I want everybody to have a chance at life. And so healthcare is very, very important to me. And that being one of your three pillars made a huge difference in terms of me participating in politics. I'm not
Thank you.
a politician mode, but it made a huge difference. On this show, we still, as it says, we pause for the truth. So we give everybody an opportunity to speak to the truth. And if they choose not to, that's on them. So, your opponent, welcome to come to the show and at least, we pose the same questions that we pose to you, pose to them. So thank you very much again for coming to our show. And we look forward that if you can get back to us in the future. I know you're very busy, but if you can get back to us, we would much appreciate and we'll welcome you back to the show.
Thank you so much for the time. I appreciate you all so much. Thank you for everything you do for our community. I appreciate you.
So thank you for all of you who've tuned in tonight on Pause for the Truth. Thank you, Donna, for joining us. Thank you, Dr. Kane, as usual. On Pause for the Truth, as we say all the time, we're here to help you understand what's really going on and why. Again, education is the foundation of all that we do. Good health is a foundation of all that we can do and even want to do. We've learned a lot here at the past. This is our 84th podcast show. We've learned a lot about food deserts, heat deserts, and communities or individuals who don't have access to health care. What we hope is that we will come together as a community, learn how to work together, no matter what your party affiliation with is. You just care about people and what happened to people. I learned something today that I did not know about, and I'm not going to expose it tonight, but Donna kind of touched on it when she was talking about how people have to go to homeless shelters and that they have to leave at a time of day. I said what I learned today, we're gonna talk about in a future podcast. But thank you to those of you who've never tuned in before. Check us out every Tuesday, 6:30 to 7:30 p.m. on Pause for the Truth. If you have any suggestions for topics for the show, email us at info@pauseforthetruth.com. Thank you again, Donna. And if your opponent is listening, we look forward to you coming on the show so that we can hear your ideas about health and healthcare. Good evening, everyone.
Good evening. Thank you again.